Thanks, Karen Corley. 783 new cases today. I think that's the highest daily case number since February. The 7-day average case number has now doubled in the course of the last month. We know that in the Netherlands, case numbers have gone up by 500% in the course of 1 week after reopening hospitality. Look at the graphs of what has been happening in Britain and then in a delayed fashion in the rest of Europe when you have the reopening of indoor hospitality. The case numbers in the context of Delta shoot through the roof. And what comes inevitably after that, yes, at a lower and slower rate, thankfully due to vaccinations than previously, is hospitalisation. In Britain, hospitalisation is now up by 54%, according to the CMO at the press event today. So don't believe it when people tell you that we can just open up and there'll be no consequences in terms of lost lives. It's not true. As night follows day, hospitalizations will increase as a consequence, and deaths and long COVID, in particular for young people, will be a lasting impact. At the NEFIT press event today, Dr. Nolan said that if we continue at the current rates that we're at, he said if nothing else changes, our case counts will double every 15 to 29 days. So go from 700 to 1,400 to 2,800. You can see the kind of numbers we'll be in a month or a month and a half's time. He says if nothing else changes, and yet we're here in the Dáil today, the second last day of the Dáil term, with rushed legislation introducing discrimination without any pre-legislative scrutiny whatsoever, major implications in terms of the health surveillance of people, creating a real division, an unnecessary division, extra division in society. Why? To facilitate the reopening of indoor hospitality. So things aren't going to stay as they are, and cases double every 15 to 25 days. Instead, we're going to open the tap in terms of significant more increases. And who will pay the price for that? The hospitality workers. So again, Dr. Holohan at the press event today encouraged the unvaccinated people to be very careful in terms of hospitality and going indoor elsewhere. But tell that to the hospitality workers, who are by and large young, by and large unvaccinated. They have no choice. They have no choice but to turn up for work where they are at risk. Dangerous implications for society as a whole, and also I would raise the point, because I think the government's operating on the basis that we only have a forward gear here, so we just keep going forward. But if, as Deputy Kenny has pointed out, we're in a crisis situation in a month and a half's time, possibility of the Dáil being recalled, I wonder, will we manage to get out of this place in September like we're meant to be out of this place? At that point, the government may have no choice but to reverse course and to reimpose a lockdown. And that's the last thing that people want to see. People want to see a protection of the gains that have been made in terms of outdoor hospitality and so on, and yet that is what is endangered. I want to make the point, and it was actually already made by a government backbench TD, in terms of the unvaccinated under 18s. There is no basis in public health advice for what the government is doing. I asked the Taoiseach about it yesterday, and he confirmed that NEFIT did not sign off on this, did not agree to this, but he says it's fine because they're in a family bubble. A family bubble in a pub with no masks when the hospitality workers haven't been vaccinated. That's a crazy, crazy idea, and it means that it will accelerate the spread of the virus. There was an alternative in terms of doing what we advocated 7 weeks ago, mandatory hotel quarantine for England, Scotland and Wales, to stop or to slow the spread of the Delta variant here. But there's also an alternative now. It's presented by some in this House that we're opposed to discrimination. Yes, we agree. And the way to oppose discrimination is just to reopen all of indoor hospitality for everybody. Well, no, there is an alternative. No introduction of discrimination. Hold off on the reopening of indoor hospitality. We're almost there in terms of vaccination. 6, 7, 8 weeks until we have a very high level of vaccination in the population. So let's hold off on that. Let's provide proper income supports for the small pub, the restaurant owners, and for the workers. Withdraw your threatened PUP cuts, so protect the lives, protect the incomes of people, and in that way you put people's needs before the private lobbying that's been going on. Thanks.